white and black coats, in a biased random walk, spurting opinions across the rectangular room. Aromatase inhibitors get juxtaposed with organ-sparing IMRT, and circulating lymphoma cells shake hands with neutropenic sepsis. She sits there, hands in the air, arguing vehemently about dose escalation, stopping rules, screening, and early detection. The novelty of the Bayesian design intrigues her. PK, PD in her world are not names of athletes, and Martingale is hardly a bird. Smart science tastes like Bloody Mary in a gold-rimmed glass. It has the zing and aura, both. Saturday evening at a party, shyness blended with admiration from a junior colleague. "I have read most of your articles." And then with a sheepish grin, "Never imagined you would wear flowers on your hair. Never fancied you feeding rice balls to your son by hand or chasing butterflies with your daughter." "I fooled you, didn't I?" She laughs out loud. But inside, she feels large, bursting with multitudes of contradictions. When the slightly nervous nurse walks into the room, she still thinks she knows it all. There is a very aggressive form of cancer that can present this way. Median survival, 4.6 months. What is 0.6 months in days? Is it on the other side of the orange and yellow leaves? But there are summer birthdays to celebrate, and fall beginnings, or perhaps closures. She walks along the hallway of the hospital, maintaining the midline, life passing by on both sides of her, like action and reaction. She can smell the jasmine on a summer evening at the roadside flower shop in Gold Park, the drizzle of cocoa on the cherry flan she makes for her children, the warm embraces of the first return to home, the walk in the rains, and the March wind lifting dry leaves as the princess of Manipur rests her soul in Urjun's eyes. Amar onge onge ke bajaye banshi. Somebody taps her from behind. She turns around. It's her childhood, her youth, her today. Whatever happens tomorrow, life is calling her today. She answers.